This is an example of the shock absorption of the lumbar spine or the lower back. Notice in the blue structure, which is the disc, notice the nucleus in the middle, which acts as a pivoting mechanism, and this video is cycling through different degrees of thinning of the disc. So it shows you how the disc is prone to breaking down. This training is going to be teaching you how to keep this from happening or minimizing the breakdown or loss of the disc thickness over time. To use your spine, especially your lumbar spine, more like an elevator than like a crane. Do not crane it forward. Keep it upright. Now, disc fibers. We're going to show you some video clips about how disc fibers tear and how discs herniate. Think of the disc between the bones just like a jelly donut, right in between the bones. Just like there's jelly in the middle of a jelly donut, there's an outer ring. In the disc, the outer ring is called the annulus fibrosus. The middle portion is called the nucleus pulposus, which I'm going to show you video clips of in a minute. The annulus is the outer ring. That's where we tend to get tiny little micro tears, little radial tears around these concentric rings. And it's those micro tears that allow the outer ring to get weaker and weaker and weaker, and they allow the jelly in the middle of the donut to slowly migrate from the center out into the periphery of the donut. So again, I'll be showing you some video clips about how that works in a minute. But it's a micro tear. It's very gradual and it's cumulative, and it breaks down the strength of the disc. It can take months or years. Now, researchers have gone into the lab to figure out what movements really cause those micro tears to really be increased. Researchers have taken spine cadavers and put them under vise and crushed spines and put them in machines that pull them apart to see what movements, what motions cause more tears of the microfibers of the outer ring of the disc. They found that the disc is quite strong when you compress the spine or when you pull it apart. And the example I'll use, remember the old Chinese handcuffs? The little things you slip around your fingers, and when you slip them in, when you pull it apart, because the fibers are arranged in an elliptical fashion, when you pull it apart, it actually clamps down. It's very strong. And that's the way the disc is. It has these little fibers around the outer ring, and they're arranged in an elliptical pattern. So the disc is very strong when you pull it apart. It's very strong when you compress it. Now, the spine can handle a certain amount of twisting, and it can handle a certain amount of bending. We can go through life bending and twisting, but what causes the micro tears more than anything is when you combine bending with twisting at the same time. So the spine can handle bending, it can handle some twisting, it can handle some up and down or pulling apart or compression, but when you repetitively bend with a twist, that's when you get more micro tears. So for an example, a teenager or someone who bales hay for a living would be an example of an occupation that would be the very worst thing you could do, because it's a heavy object and you're repetitively bending and twisting and you're stacking bales of hay. That would be an example of the very worst kind of motion you could put your spine through. But that's a heavier object. Same rule applies for lighter objects. So, for example, if you are planting flowers and you're bending and twisting over and over, or if you're locking your legs and you're doing windmills, not a good idea, not smart. It breaks the rules. It's running a risk. It's rolling the dice. You may be getting too many tears. Don't bend and twist. Anything in life. Now, everyday activities like moving a vacuum cleaner. When you move a vacuum cleaner, you should move your whole body with the vacuum cleaner. Do not just plant your feet and torque like this. That's the motion that's going to tend to overly irritate your lower back and add to the micro tears. Another simple everyday thing, moving a broom. Move your whole body with your broom. Never lock your lower legs and just do it this way. Or raking leaves, same rule applies. You're holding your rake, move your whole body with the rake. Do not plant and do this unless you want to have a bad episode with your back. Think of the microfibers that are protecting the inner donut jelly. Think of that as a checking account. We have a certain number of little micro tears that our body will allow, until it gets weak enough that the jelly finally migrates to the outer wall. If you get too many of those, you're going to start bouncing checks, okay? But if you don't have so many that it finally, if the jelly doesn't finally burst to the outer wall, we're not in pain. That's where we get lulled into a sense of complacency. We do an activity long enough, incorrectly, without pain, that we think it's okay. We begin to think that that activity or that movement is okay because we don't have pain right now. But if it's incorrectly done and it's breaking down the integrity of the disc, and you do it for 5 years, 10 years, 15 years, finally you have a crisis episode, but it may have taken years and years and years to weaken the disc where the nucleus finally bursts to the outer wall. So understand it may take a long time, and just because you can go to yoga or you can do something and you can touch the floor and bend down, that doesn't mean it's necessarily good for you. Now, having said that, I love yoga. I love Pilates. Do not get me wrong. I love those things. However, if you already have a weak disc, or if you are okay with running the risk of making your disc weak if it hasn't already been injured, you are taking a big risk. I don't care where you are. If you're in your kitchen, if you're in the garage, if you're on the farm, if you're in a Pilates class, if you're in a yoga class, you are running the risk of making the disc weaker if you're repetitively bending and twisting. Now, if you're in a yoga class, great. But if you have a herniated or bulging disc, and there are 20 other people in the class, and they are all bending down and touching the floor, and you feel compelled to do it as well, you are running the risk of making your lumbar spine worse. Keep that in mind. I want people to understand that I love yoga. I love these things, but for those who have weak lumbar discs, they better not be doing bending and twisting. Okay? This sheet also talks about numbness or pain going down the leg. Sciatic pain. There are a number of things that can cause irritation of the sciatic nerve, which branches off here and goes down the leg. Sometimes it'll go down the back. A segment a little higher, hitting the nerve might cause it to go down the side or the front of the thigh. But the most common is the sciatic irritation from the L5 disc right around the belt line. L5 is here, L4 is here. Bulging of that disc can cause pressure on the nerve, which can finally cause it to go down the leg. It can go all the way down. Depending on how unstable the disc is, decompression or traction therapy often is a very wonderful therapy that often does work very, very well. For those discs that are badly herniated or fragmented, what we call sequestered, where there's a weakness of the disc that's really like a jelly donut where it's burst all the way out of the center of the disc, those are the kind that typically are more likely to end up in surgery. Now, our goal is to be as conservative as we can to the extent possible. Often we can help turn these things around. We have decompression therapy. It's traction, kind of a high-tech rack, kind of like we have for the neck. It's also for the lumbar spine. And it's designed to, you lie down, there's a harness that fits from your waist down and a harness that fits from your waist up. And it has a cable, and you lie down, and the cable pulls. We set the computer at a certain poundage, and it tugs and pulls you apart, and then it slowly ramps down and it lightens up, and so the spine is decompressing like this. It's actually pulling it apart, and then gradually, slowly relaxing it, and then pulling it apart, and then gradually, slowly relaxing it, and so you're getting this decompression effect over time, and each time it pulls it apart, it creates a vacuum effect. So if you think of my thumb like the disc, when it pulls it apart, if the nucleus is bursting out, it pulls it back to the middle. And then when you stand up again, it tends to push back out again, which isn't good. But if you do the traction repetitively, we find that little by little, it creates a certain type of traction that pulls that nucleus back toward the middle and away from the nerve. The video clips I'm going to show you in a little while will demonstrate this more clearly. So traction is a very helpful way to treat the lumbar spine. We also use different